Bengaluru, 30th July 2025. The glow of the ceremonial lamp shone brightly as Apollo Cancer Centers launched a visionary initiative, EndoCheck, a comprehensive early screening and diagnosis program aimed at fighting two of the deadliest gynecologic cancers, endometrial and ovarian cancers. Apollo Cancer Centers, India's trusted name in cancer care, reinforced its commitment to preventive oncology for women through this timely and powerful step. EndoCheck specifically targets women aged 45 and above, especially postmenopausal women, providing risk based assessments, early diagnostic tests, and symptom evaluations, all under one program. Did you know that ovarian cancer is often called the silent killer? It typically affects women between 55 and 64 years, with the average diagnosis happening at age 63. But here's the catch: if detected by 2025, total cancer cases in India are expected to rise to 1.57 million. Ovarian and uterine cancers continue to rank in the top 5 cancers among Indian women, with urban lifestyle shifts, metabolic conditions, and reproductive pattern changes, the risk factors are growing rapidly. Endometrial cancer, though more likely to present symptoms like abnormal bleeding or discharge, often goes unreported until it's too late. This leads to delayed diagnoses and poor outcomes, a gap that EndoCheck aims to bridge. Mr. Dinesh Madhavan, President of Group Oncology International, Apollo Hospitals, emphasized early detection remains our strongest ally in cancer care. EndoCheck shifts the narrative from treatment to prevention, delivering timely diagnosis and precision care. Dr. Rani Bhat, Senior Consultant Gynae Oncology at Apollo Cancer Center, Bengaluru, added the incidence of endometrial cancer is increasing. Early detection can save lives, with survival rates close to 90% for localized disease. But with rising obesity, diabetes, PCOS, and hormonal changes, women need to be more alert than ever. According to Dr. Aruna Patil, Head of Radiology, Radiology is at the heart of this initiative. Using transvaginal ultrasonography, TVS, we aim to identify even the smallest signs of cancer early, giving doctors a head start in treatment planning. Apollo Cancer Centers has created a powerful network of 400 oncologists across India, delivering with South Asia's first pencil beam proton therapy center. Apollo is not just India's leader, it's the world's hope. Patients from over
The
147
flow for
countries
a
trust
brief
Apollo for their cancer journey. To take the first step toward early detection, reach out today. Telephone receiver 24/7 Patient Helpline 0404896415, because with EndoCheck, hope begins with awareness.
Namaskara. Very good afternoon, everyone. I thank you all for being here today. It's a privilege to address such a gathering, especially for a cause which is close to our hearts, the health and well-being of a woman. When women health is prioritized, families thrive and communities rise. Despite of this, we are seeing that women do come to us in late stages and we are losing them for cancer in advanced stages. Now here we are talking about two important cancers in women, that is ovarian cancer and endometrial cancer. Most of you all would have heard ovarian cancer is a silent killer. But let me tell you, it is not that silent. It does gives away some warning signals like abdominal discomfort, bloating sensation, then unable to eat well. And most of these patients, they think it is some gas problem and they end up going to a medical gastroenterologist who gives them some prescription. The symptoms persist, abdomen becomes bigger, and then they realize something is wrong. They go for the scan, and then they realize that ovarian cancer is an advanced stage. So, again, as I said, it's not a silent killer, but it gives us silent symptoms there. So, what we have to tell every lady is that if her symptoms persist and they do not subside even with the simple medications what they have been given, then yes, they have to come and get thoroughly evaluated. Most of the ovarian cancers are we have seen with as the age increases, the incidence increases. But again, we do see a wide range. It can happen anywhere from 50 to 65 years. It is very, very important that when people come to us for screening, taking a good history. Because if there is any family history of breast cancer, or she had an ovarian cancer, or this lady had a simple non cancerous condition called endometriosis. Endometriosis is a very, very common condition in young reproductive age group women. But what most of them fail to understand is that this endometriosis tomorrow can turn into cancer. Recently, we had a lady known to have endometriosis for many years, and she took alternative treatment thinking it will subside. She went to a lot of doctors where they said it is a simple endometriosis. She was the CEO of a company, and she came to us when she was in stage 3 ovarian cancer. When I was discussing with her, she said, Doctor, nobody told me that this could lead to cancer in the future. Yes, the incidence may be very low. Not all endometriosis will lead to cancer, but why is it important that we take a thorough history and we have to counsel those patients is that so that they're regularly following up and we can identify those early signs and symptoms, be it a symptoms or radiology imaging, and we could have picked her up in a very, very early stage and the treatment would have been much, much simpler for her. Now, coming to the other one is endometrial cancer. Now, if we see incidence of obesity is really increasing in India. Again, women who have had early period, again, why does that happen? Young girls who are obese, they have hormonal disruption, so they have early period. Women who have late menopause, again, that is again indirectly related to possibility of obesity. Women with diabetes, these women are at increased risk of developing endometrial cancer. We see young girls these days with a condition called polycystic ovarian disease. Again, it's a very, very simple and common condition most of the girls will go through. But what counseling has to be done is that PCOS is a metabolic condition. So that has to be identified and addressed well. Because if you don't nip it in the bud, then yes, tomorrow that girl may end up with an endometrial cancer later in life. So these are the two important, though the symptoms are there. With endometrial cancer, most of them they come to us with irregular bleeding. And I've heard patients telling, saying, my mother said, yes, it happens. The neighbor said it happened to her also. So what we are here to tell is that please let these women not ignore those subtle symptoms. If they are persisting, yes, they have to get it checked. So early detection. Now, if again, as I said, when there's a delay in diagnosis, it costs us something valuable, that is time. Time is very important because we can catch them early. If we miss that time, again, we can end up having these women in advanced cancer. Now, EndoCheck, why is that we have come up with this is that it is just not like any other lab test or anything. Here, we are going to have these women have a thorough consultation, proper history taking, and we risk prioritize them who are at high risk and who are at low risk, and we do a simple transvaginal ultrasound. Most of the health checks what are available, they do the reverse. They do a blood test called CA125, which can be elevated in various conditions, and then they come to us saying like, they don't have an ultrasound, but CA125 is there. So that's a very wrong way to do. So the best is again, as I said, a thorough history taking. Did you have early period? Did you have any polycystic ovary in your young age? Any cancers in the family? Do you have diabetes, hypertension? We evaluate the patient thoroughly and then we kind of like advise them to have a transvaginal ultrasound. Based on what we find, yes, lucky enough, most of the time we do find if we do it correctly in a precancerous condition. So EndoCheck is just not a tool but this is an opportunity for us to educate women, tell them what are the risks that they are, and yes, when we identify the high risk, we keep them under close observation, because it is not general once a year you do some blood tests and come back, once a year you do your health check. No, high risk women, they need to be closely monitored, because they may need an ultrasound once in 6 months and not once in a year, and this will happen only if there is a proper consultation and proper history taking. So, our message to women is that do not ignore even a minor symptoms, do not brush it away, saying this is just a minor, everybody has it, because we really do not know who has a simple condition, who has a precancerous or a cancerous condition. So, we are very happy that we are coming up with this initiative to take this bold step and to protect our women, educate them and screen them and catch them in an early stage, because we know when we treat them in an early stage we have various options, especially young women fertility preservation surgeries, or young women when they have early stage cancers, when we treat them the lifestyle is much better than in the advanced stages. So I'm very privileged that we are initiating this, and I'll be honored that if you can go about and tell that every lady shouldn't ignore these subtle symptoms, and not to go to Google, but please go to a doctor and have a thorough consultation and proper evaluation. Thank you.
Could do, AI could do and enable, whether it's a robo or whether it's IPEC or PIPEC, cytoreductive surgeries or oncofertility. What got us thinking is, what do we create as a product line to be offered that anybody could go to the neighborhood and get done? So the EndoCheck program, though being introduced by Apollo, can be actually done by any radiologist or sonologist who has an ultrasound machine, and there are thousands of them in Bangalore. And while we do this announcement today, it is just not restricted to Bangalore. It's a pan-India program which we launch. But after the diagnosis, what would you do for a cancer which today does not have a vaccine? Fortunately for the gynecological cancers in the cervix and those of which is affected HPV, there are vaccines. But in endometrial and ovarian, there's a small, very small, negligible indication of squamous cells on the ovarian and the endometrium, which you can maybe in some extent get protection from a vaccine, which India plans to do in the vaccine program for cervical cancers, which is the HPV vaccine. The only option which is time tested for ages is get things done earlier so it's easier for you, and that's why we set out to do the screening program. One of the things we also envisage to do is you could get it done not necessarily at Apollo, while the Apollo network of clinics, maternity centers and hospitals are available for a lady who's of a certain age or has got a certain symptom or a certain risk to go to. Any hospital, nursing home, or a diagnostic center today can provide an endo check. So the Apollo team plans to partner statewide or nationwide to ensure that the person can get it done within the access point of their own living communities rather than traveling. Post that, if there is an intervention needed, as rightly said by Dr. Rani, but people are coming to you late, people are coming to you because symptoms are not available, or somebody is getting a CA 125, which necessarily is not for Gynae, it's for so many other cancers, and then thinking that you haven't done is actually post the intervention, diagnosis, get a biopsy done, figure out the staging, and then actually come to a gynecologist. And that gynecologist today could actually partner, work with a gynecologist to create an access program beyond what exists today. And with the launch of this EndoCheck, we hope that people are able to access a test within their neighborhood, find an early diagnosis, get in touch with their own gynecologist, access the gynecologist, and access the gynecologist within the Apollo network, so that jointly they can actually ensure that they work together to win over the cancer. Today's ovarian cancer and endometrial cancer constitute close to about 78,000 new patients a year. And if you look at the change rapidly, endometrial cancer is the fourth common cancer among the cancers in women, and at the rate that you're seeing, the incidence might move to 3, and ovarian is number 2. And I think as members of the media and at people from the medical fraternity, it's a job to raise awareness at every touch point that somebody could understand this program and step forward and get an endo check. And I urge members of the media to create the desired visibility, readability, and also the
endometrial and ovarian cancers. So these two cancers are one of the common cause of death and ailment affecting our Indian women. So early diagnosis helps to contain the disease before it spreads. So there is staging of the diseases. So when it goes to stage 3 or 4, the treatment options are less, they become more aggressive with equal side effects and all. So it is important that the early diagnosis is made to contain the spread, and imaging plays a very crucial role in that aspect. So in radiology, in EndoCheck program, we use a high resolution endoluminal ultrasound, which is a transvaginal ultrasound. So it is a radiation free, very easily available, non-invasive technique, and any women can undergo this without any hassle. So this gives good detail about the endometrial thickness. We actually measure the thickness. We have a criteria for premenopausal, postmenopausal. So there is a cutoff, size cutoff, above which we have to be suspicious. So this gives details about the endometrial thickness, how the endometrium interface with the adjacent organs, if there is any invasion or spread. Those subtle details can be understood. And as we know that cancer actually causes increased vascularity, blood supply. So all those blood supply, extra blood supply can be easily picked up using Doppler methods. And these suspicious patients are then subjected to biopsy. So it's referred to the Gynae onco. So they counsel the patients and probably do an hysteroscopy and biopsy. And if it is proven, again the role of radiology becomes very important. So in a proven case of endometrial CA or ovarian CA, we need to stage the disease. So we have very good diagnostic options like MR and PET CT, so which gives both the local staging of the disease as well as spread to other organs. So we can holistically assess at what stage the disease is. So that is very important for the management option. So radiology has very key role in the early diagnosis, in staging as well as in post-treatment follow-up. So it is important that patients are aware of these high-end investigations, which are easily available at Apollo centers. So here at Apollo, we have a superior clinical acumen and latest imaging technologies, and even the treatment options. So all these brought together, it brings a lot of hope to our women community. I think it is important for us to create awareness among the women community, and I hope this EndoCheck program is really gonna spread the awareness. So any patients, like Dr. Rani Bhat told, any patients with early symptoms of abnormal irregular bleeding or abdominal distension, bloating, non-specific vague pain, I think they should undergo these tests and get their body checked. The same applies to ovarian cancer as well. So we have ovarian cysts, which are mostly benign, but then imaging really helps us to provide the details of malignant changes, cancer changes within the cyst. So we try to take the size, the morphology, we assess the pattern of the cyst. So there are a lot of innovations. We use artificial intelligence also. So that gives us whether the cyst is going to behave in a benign manner or it is going to turn cancer. So that way, imaging really plays a great role in diagnosis of ovarian cancer as well. So I'm really
ಓಕೆ ನಮಸ್ಕಾರ. ನನ್ನ ಹೆಸರು ಡಾಕ್ಟರ್ ರಾಣಿ ಭಟ್ ಅಂತ, ಗೈನಿ ಆಂಕಾಲಜಿಸ್ಟ್, ಅಪೋಲೋ ಹಾಸ್ಪಿಟಲ್ ಬ್ಯಾಂಗ್ಳೂರ್. ಸೊ ನನ್ನ ಸ್ಪೆಷಾಲಿಟಿ ಏನಂದರೆ, ನಾನು ಹೆಂಗಸರಿಗೆ ಕ್ಯಾನ್ಸರ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡೋ ಡಾಕ್ಟರ್ ನಾನು. ಸೊ ಇವತ್ತು ವಿ ಆರ್ ವೆರಿ ಪ್ರೌಡ್, ನಾವೊಂದು ಎಂಡೋಚೆಕ್ ಟೆಸ್ಟ್ ಅಂತ ಇಂಟ್ರಡ್ಯೂಸ್ ಮಾಡ್ತಿದ್ದೀವಿ. ಹೆಂಗಸರಿಗೆ ನೀವು ಕೇಳಿರ್ಬೋದು, ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್ ಇಸ್ ಅ ಕಾಮನ್ ಕ್ಯಾನ್ಸರ್ ಅಂತ. ಬಟ್ ನಾವು ಮರೆಯೋದೇನಂದರೆ, ಸರ್ವಿಕ್ಸ್ ಆದ ನಂತರ ಯುಟ್ರಸ್ ಅಂದರೆ ಗರ್ಭಚಲ ಕ್ಯಾನ್ಸರು, ಅದ್ರ ಪಕ್ಕದ ಓವರಿ ಅಂದರೆ ಅಂಡಾಶಯದ ಕ್ಯಾನ್ಸರ್ನು ಆಗಲಿಕ್ಕೆ ಹೈ ಚಾನ್ಸ್ ಇದೆ. ಸೊ ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ ನಮ್ಗೆ ಗೊತ್ತಿದೆ, ನಾವು ಹೋಗಿ ಪ್ಯಾಪ್ಸ್ಮೇರ್ ಮಾಡಿಸ್ಕೋಬೇಕು, ವ್ಯಾಕ್ಸಿನ್ ತಗೋಬೇಕಂತ. ಬಟ್ ಎಂಡೋಮೆಟ್ರಿಯಮ್ ಗರ್ಭಚೀಲದ್ದು ಮತ್ತು ಓವರಿ ಕ್ಯಾನ್ಸರ್ಗೆ ಎಂತ ಮಾಡಬೇಕಂತ ಸುಮಾರು ಪೇಷಂಟ್ಸ್ಗೆ ಎಂತ ಮಾಡೋದು, ಏನು ಟೆಸ್ಟ್ ಮಾಡಿಸ್ಬೇಕಂತನೂ ಅರ್ಥ ಆಗಲ್ಲ. ನಾನು ಹೇಳೋದು ಏನಂದರೆ, ನೋಡಿ, ಓವೇರಿಯನ್ ಕ್ಯಾನ್ಸರ್ ಪೇಷಂಟ್ಸ್ಗೆ ಅವರ ಸಿಂಪ್ಟಮ್ಸು ತುಂಬ ವೇಗಾಗಿ ಇರ್ಬೋದು. ಅಂದರೆ ಹೊಟ್ಟೆದಲ್ಲಿ ಸ್ವಲ್ಪ ಭಾರಿ ಥರ, ಇಲ್ಲಾದರೆ ತಿನ್ನಲಿಕ್ಕೆ ಆಗ್ತಾ ಇಲ್ಲ, ಸ್ವಲ್ಪ ತಿಂದೆ ಹೊಟ್ಟೆ ಭಾರಿ ಅನಿಸ್ತಾ ಇದೆ ಮೇಡಮ್ ಅಂತ ಬರ್ತಾರೆ. ಒಮ್ಮೊಮ್ಮೆ ಅದು ಗ್ಯಾಸ್ಟ್ರಿಕ್ ಪ್ರಾಬ್ಲಮ್ ಏನೋ ಅಂತ ಗ್ಯಾಸ್ಟ್ರಿಕ್ ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗಿ ಅಲ್ಲಿ ಸ್ವಲ್ಪ ಟೈಮ್ ವೇಸ್ಟ್ ಆಗುತ್ತೆ. ಅದಾದ ನಂತರ ಎಂತ ಆಗುತ್ತೆ, ನಮ್ಮ ಹತ್ರ ಬರೋದಷ್ಟಿಗೆ ಅವ್ರು ಸ್ವಲ್ಪ ಅಡ್ವಾನ್ಸ್ ಸ್ಟೇಜಲ್ಲಿ ಬಂದ್ಬಿಡ್ತಾರೆ. ಸೊ ನಿಮಗೆ ಬೈ ಚಾನ್ಸ್ ನಿಮ್ಗೆ ಹೊಟ್ಟೆದಲ್ಲಿ ಭಾರಿ ಇರೋದು, ಇಲ್ಲಾಂದ್ರೆ ತಿನ್ಲಿಕ್ಕೆ ಆಗ್ತಾ ಇಲ್ಲ, ಏನೋ ಬಿಗಿಯಾಗಿ ಇದೆ ನಿಮ್ಮ ಹೊಟ್ಟೆದಲ್ಲಿ ಅಂತ ಇದ್ರೆ ಇಮಿಡಿಯೇಟ್ ಆಗಿ ಹತ್ರದಲ್ಲಿ ಯಾವ ಗೈನಕಾಲಜಿಸ್ಟ್ ಇದ್ದಾರೋ ಅವ್ರ ಹತ್ರ ಹೋಗೋ ಮುಂಚೆ ಒಂದು ಲಿಸ್ಟಲ್ಲಿ ನಿಮ್ಮ ಪ್ರಾಬ್ಲಮ್ಸ್ ಎಂತ ಇದೆ ಅದೆಲ್ಲ ಬರ್ಕೊಂಡು ಹೋಗಿ ಅವ್ರ ಹತ್ರ ಹೇಳಿ. ಅವ್ರೊಂದು ಸಿಂಪಲ್ ಸ್ಕ್ಯಾನ್ ಮಾಡ್ಬೋದು ನಿಮಗೆ. ಸ್ಕ್ಯಾನಲ್ಲಿ ನಿಮ್ಮ ಗರ್ಭಚೀಲ ಓವರಿ ಹೇಗೆ ಇದೆ ಅಂತ ನೋಡಿಬಿಟ್ಟು ಅವರು ಪ್ರಾಬ್ಲಮ್ ಇದೆಯಾ ಇಲ್ಲ, ಪ್ರಾಬ್ಲಮ್ ಇದ್ರೆ ಎಂತ ಟೆಸ್ಟ್ ಮಾಡ್ಬೇಕಂತ ಹೇಳ್ಕೊಡ್ತಾರೆ. ಅದೇ ನಂತರ ಗರ್ಭಚೀಲದ ಕ್ಯಾನ್ಸರ್ ಇತ್ತೀಚೆಗೆ ನಾವು ನೋಡ್ಕೊಂಡ್ರೆ ಇಂಡಿಯಾದಲ್ಲಿ ಸಿಕ್ಕಾಪಟ್ಟೆ ಪೇಷಂಟ್ಸ್ ತುಂಬ ತೋರ ಹಾಕ್ತಿದ್ದಾರೆ, ಡಯಾಬಿಟಿಸ್ ಜಾಸ್ತಿ ಇದೆ. ಇಂಥ ಪೇಷಂಟ್ಸ್ ಅಲ್ಲಿ ಗರ್ಭಚೀಲ ಕ್ಯಾನ್ಸರ್ ಆಗೋದು ತುಂಬ ಹೈ ಇದೆ. ಸೊ ನಿಮ್ಗೆ ಗೊತ್ತಿದೆ ಪೀರಿಯಡ್ ಸ್ಟಾರ್ಟ್ ಆದಾಗಿಂದ ನಿಮ್ಮ ಪೀರಿಯಡ್ ಹೇಗೆ ಇದೆ ಅಂತ. ಅದು ಬಿಟ್ಟು ಪೀರಿಯಡ್ ಅಲ್ಲಿ ಸ್ವಲ್ಪ ವ್ಯತ್ಯಾಸ ಕಾಣಿಸ್ಕೊಂತು, ಹೆವಿ ಬ್ಲೀಡಿಂಗ್ ಇದೆ, ಪೀರಿಯಡ್ ಮಧ್ಯದಲ್ಲಿ ಬ್ಲೀಡಿಂಗ್ ಕಾಣಿಸ್ಕೊಂತ ಇದೆ, ಇಲ್ಲಾಂದ್ರೆ ಪೀರಿಯಡ್ ನಿಂತು 1 ವರ್ಷ ಆದ ನಂತರ ಮತ್ತೆ ಬ್ಲೀಡಿಂಗ್ ಕಾಣಿಸ್ಕೊಂಡ್ರೆ ಅದು ಇಮಿಡಿಯೇಟ್ ಆಗಿ ನೀವು ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗಿ ತೋರಿಸಿ. ಮನೆಯಲ್ಲಿದ್ದು ತಾಯಿಗೂ ಹಾಗೆ ಆಯಿತು, ಪಕ್ಕದ ಮನೆಯವ್ರಿಗೂ ಹಾಗೆ ಆಯಿತು ಅಂತ ನೆಗ್ಲೆಕ್ಟ್ ಮಾಡಬೇಡಿ. ಸೊ ಸಿನ್ಸಿಯರ್ ಅಡ್ವೈಸ್, ನೀವು ಪ್ರತಿ ಇಯರ್ ಎಂತ ಏನಾದರೂ ಚೆಕಪ್ ಹೋಗೋ ಹಾಗಿದ್ರೆ ನಾವು ಈ ಎಂಡೋ ಚೆಕ್ ಅಂತ ಹೇಳೋದೇನಂದರೆ, ಎಂಡೋಮೆಟ್ರಿಯಮ್ ಅಂದರೆ ಗರ್ಭಚೀಲದು, ಓವರಿದು, ಅಂಡಾಶಯದು ಎರಡು ಸಿಂಪಲ್ ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗಿ ಅವರು ಹೇಳಿದ್ದು ಪ್ರಶ್ನೆಗೆ ನೀವು ಜವಾಬು ಕೊಟ್ಟು ಸ್ಕ್ಯಾನ್ ಮಾಡಿ ಅದರಲ್ಲಿ ನಾರ್ಮಲ್ ಇದೆಯಾ ಇಲ್ಲ ಅಂತ ಹೇಳ್ತಾರೆ. ಇಂಪಾರ್ಟೆಂಟ್ ಏನಂದರೆ ನಾವು ಅರ್ಲಿ ಕಂಡಿಟ್ರೆ ನಾವು ಕ್ಯಾನ್ಸರ್ ಆಗಿ ಟರ್ನ್ ಆಗೋ ಅಲ್ಲಿನೂ ಪ್ರಿವೆಂಟ್ ಮಾಡ್ಬೋದು. ಬೈ ಚಾನ್ಸ್ ನಾವು ಅರ್ಲಿ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಕಂಡಿಟ್ರೇನೋ ಅದು ಟ್ರೀಟ್ ಮಾಡಿ ಕ್ಯೂರ್ ಮಾಡ್ಬೋದು. ನಮಸ್ಕಾರ, ಥ್ಯಾಂಕ್ ಯು.